you absolutely should not be using them if you're pregnant, and we will tell you why.
This is purely just concern because we never want to take any risk with pregnancy, and we do know that oral Accutane or retinoids absolutely causes birth defects. So
as long as you don't have like a premature infant and you're not like slathering your tretinoin all over your nipples, you can use tretinoin in breastfeeding.
I mean, just absolutely stop when you're pregnant or planning to get pregnant. And then
let's talk about who they're for and who they're not. So I think the biggest thing that you need to know about retinoids and retinols is you absolutely should not be using them if you're pregnant, and we will tell you why.
So this is where it's just that potential for birth defects. And this is purely just concern because we never want to take any risk with pregnancy. And we do know that oral Accutane or retinoids absolutely causes birth defects. So we want to be safe. Even though there is probably minimal absorption into your skin, the topical use and the amount that you use on your skin, we never will tell our patients to continue a topical retinoid of any form, including retinol over the counter, if you are pregnant. So this is the one thing we would want you to stop.
Yeah. And again, it's really out of an abundance of precaution because this is a very similar molecule per se. It is the topical version of Accutane. And if you know anything about Accutane, if you know anyone who's ever been on it, if you've ever been on it, you absolutely cannot get pregnant when you're on it. And I saw these like really funny TikToks recently about how they really drill it in that you can't get pregnant when you're on Accutane. Like every time you open up, I've actually never seen Accutane. Like I've never seen the pills, even though I prescribe it every day. That when every time you open it up, it has like a picture of a pregnant lady on it. And it's like, do not get pregnant. It is very serious if you get pregnant on Accutane, but it kind of, it's an extrapolation that if you are on the topical version of it, such as similar molecule in the skin, that we just don't recommend it. But I highly doubt that there's enough systemic absorption that it would make a huge difference. I mean, I've known many women who have accidentally got pregnant when you're on it. So if you are on it and you accidentally get pregnant, don't freak out. The chance of there being any issues with your baby and delivery is almost close to nothing. But with that being said, like if you're trying to conceive, I switch my patients off of tretinoin and I'll put them on something pregnancy safe like azelaic acid instead.
Yeah, there are a lot of great options. And also along the same line, you can absolutely use it if you are nursing. I think we said this back a few episodes ago.
I hate when people like say, oh, I have been off my tretinoin for 2 years because I was pregnant and I was breastfeeding. I'm like, where did you read that? Who told you that? Actually, the internet tells you that. If you type in like, can I use tretinoin when I'm breastfeeding? AI or the first website will be like, no, you can't. And that pisses me off because not only as a woman who has been pregnant twice, it's like you can't do anything. People are just afraid to even treat pregnant patients. And then like, what's your reasoning behind not using tretinoin when you're breastfeeding? Here's what the real data shows and what the real answer is. As long as you don't have like a premature infant and you're not like slathering your tretinoin all over your nipples, you can use tretinoin in breastfeeding.
Absolutely. And if you're curious about why, then I think we talked about it in our very first episode. So go ahead and check that one out. We kind of dive into the reason why you can use it while you're nursing. And then I think that's just absolutely stop when you're pregnant or planning to get pregnant. And then you can pretty much use it when you're not.
Exactly.